The highly anticipated Phase 3 trial results for yet another candidate that has been pre-purchased by Ottawa, Johnson & Johnson's single-dose vaccine, is shown to be less effective than the Pfizer-BioNTech and Moderna jabs already in use here. But Laura McQuillan, its other benefits may well outweigh that issue.
Yeah, John, you mentioned one of them just there, a single shot, which could be a breakthrough because we have seen a lot of issues with rolling out a two-shot vaccine, including having to delay the second dose. So let me walk you through what Johnson & Johnson has said here. It has come out this morning saying that it's shot in its clinical trial, Phase 3 of 43,000 people, 66% effective overall. So that is a bit lower than what we saw with the other vaccines like Pfizer and Moderna. They were around 95%. So 66% overall, 28 days after vaccination. That's once you get those antibodies working. But something that's really interesting from this study from Johnson & Johnson is that those results varied based on the geography of its test subjects. So in the United States, it was 72% effective, in Latin America, 66%, and in South Africa, 57%. So that gives you an idea of how it performs against those variants now emerging, especially out of Brazil and South Africa. Overall, Johnson & Johnson says its vaccine is 85% effective at preventing severe cases across all regions. What's important from all of this for Canada? Well, this is one of 7 vaccines that Canada is betting on. It's ordered 38 million doses of this. And while folks might think that 66% number is low, medical experts are already hailing this as good news. I just saw a tweet a few minutes ago from Dr. Isaac Bogosh. He was saying anything that prevents severe cases or hospitalizations or deaths is an obvious win. When we spoke to Dr. Matthew Alton, an infectious disease specialist, a short time ago, he said the same thing. He said something that's really good about this trial is because it was tested on 3 different continents and you can see how it performs against different variants, it gives you an idea of how this would work in the real world. But as for how it might be rolled out in Canada, when it does have that lower efficacy and it is a little later to come online, he said we'll really have to wait and see what the approval looks like if it does get over the line there. He said, however, given the logistical dilemmas there have been with those 2-shot vaccines and that ultra cold requirement for the Pfizer one, this 1-dose vaccine, which can be given out so much more easily, has a lot of upsides. Here's what he told us.
Amongst other things, the fact that this vaccine can be administered in a single dose, the fact that it doesn't require the same complicated cold chain or even freezer chain to be able to get it into the arms of end users means that, for example, this might be an ideal vaccine to deploy to remote areas, to areas where people don't have easy access either to large medical facilities that have the kinds of freezers that we've been needing for the other vaccines that have already been rolled out.
Now, in terms of what this will mean for its approval in Canada, I checked in with Health Canada a short time ago this morning. They told me that Johnson & Johnson applied for the review of their data to get that ball rolling back on November 30th. They say that its application is still under review, but as you heard there from Dr. Alton and from others who are already commenting on this morning, John, there's a lot of hope for this vaccine, even though its efficacy is a bit lower than some of the others.
Thanks for this, Laura.